Late this afternoon, we learned the interim leader of Hennepin Healthcare abruptly resigned. This as the Minneapolis hospital is already on the brink of closure. We obtained the email Dr. Kevin Croston sent saying his resignation is effective immediately. He didn't last long, only being appointed to an interim co-administrator position in January. At the time, the hospital had hoped he could help rein in a massive deficit. Jennifer Hoff has more on what happens now.
Hospital closures have a large impact on communities, from an economic decline to reduced access to care.
Thank you.
Concerns fell across western Wisconsin when 2 hospitals closed there at the same time 2 years ago. In Minnesota, more than 4 dozen have closed dating back to the 80s. But none, some may say, as unique as the Hennepin County Medical Center that's now on the chopping block.
It's where Minnesota goes when everything else has failed.
Nurses rallying at the Capitol yesterday to save the Level 1 Trauma Hospital in Minneapolis, a publicly funded safety net for people all across the upper Midwest.
When a patient is uninsured, when they're in crisis, when no other system will catch them, Hennepin County Medical Center does.
Except the number of people who can't pay and falling Medicaid reimbursements means the hospital is facing a $200 million shortfall, already firing 100 employees and closing 5 programs. Its leaders saying without financial help, it will likely close by June.
Everyone's going to feel it.
Mark Holmes is a leading public health researcher who says that only strains other systems.
Longer lines to get planned procedures or longer wait times, difficulty getting in to see specialists. These are the kinds of things that we typically see when a large urban provider ends up closing.
In a statement, Allina Health writing it relies on HCMC, particularly for gunshot wounds and carbon monoxide poisoning, saying it's not feasible to replace its expertise, advocating for lawmakers to help preserve it. But many are non-committal, even as a bill is expected to be introduced next week, raising the Hennepin County sales tax another 1% for the hospital.
Care doesn't disappear. You still have people who are uninsured and publicly insured who still need health care.
A problem that persists, and in the middle, one of the hospital's top leaders resigning just hours ago. In an email Care 11 obtained, Dr. Kevin Croston says it's effective immediately after just being appointed in January, writing micromanagement and overruling of operational decisions makes it impossible to do his job. With patient care ultimately caught in the middle.
This is just a failure of how we choose to fund care in this state and across America.
Jennifer Hoff, Care 11 News.
I mean, not like tiny, but I think it's legit.
The city of Minneapolis also reacting, saying losing HCMC means eliminating a critical access point to medical care, impacting health outcomes in particular for low-income communities. We'll be right back.